Today we're thrilled to introduce the new treatment plan feature in Bristle test results for providers. The treatment plan feature provides Bristle's interpretation of a user's test results and which treatments you may consider based on the combination of their test results and clinical symptoms. This initial version of treatment plan feature is designed to help with the management of gum disease and caries. But please note, these are suggestions, and treatment should always be determined by a licensed clinical professional. The recommended care is based on the overall dysbiosis of a patient's microbiome, looking at the levels of balance between the beneficial and pathogenic bacteria and fungi. The test results, in combination with the clinical assessment, can help personalize the patient's care based on severity. So to use the feature, first access the patient's test results and then navigate to the Treatment Plan tab, shown here. Next, using the drop-down menu, choose the patient's gum health status based on your clinical assessment. In this instance, this patient presented with periodontitis. With this information, the report will generate a suggested treatment protocol for the patient. This treatment plan includes when you may want to consider antibiotics or adjunctive therapies like laser bacterial reduction, ozone trays, and more, along with standard in-office care. We know it can be difficult to stay on top of the literature behind different interventions. So now you can click on any recommended intervention to get a description of it, its mechanism of action, and links to the available scientific literature on its efficacy. Next, we'll give a suggestion to consider for patients with incipient caries based on the levels of cavity-causing bacteria and beneficial bacteria. The recommendation here is designed to help you determine when earlier treatment may be warranted or when you may consider being a bit more conservative with at-home remineralizing approaches. For at-home care, we've narrowed down our in-report recommendations to what we believe are the highest impact interventions patients can adopt. We know giving patients too many steps all at once can set them up for non-compliance, so these are designed to be the key recommendations as a starting point for them to help improve their oral health. If you'd like more recommendations for your patients, we also now have a link to our at-home care guide, which offers a comprehensive collection of at-home treatments we found to be effective against tooth decay, gum inflammation, and halitosis, and in nurturing the beneficial bacteria. These recommendations span toothpastes, flossing approaches, mouth rinses, supplements, as well as expanded diet insights. Don't worry though, you can still access our legacy home care plans by choosing the Home Care tab in the report and share those directly with your patients. Lastly, we'll provide a suggested retesting schedule to help you determine when it's time for your patient to retest. Please note, this feature is only accessible to providers and is not included in our standard patient report. If you download and send the PDF of the report to your patient, it will be included. But if you share the online test results with your patients, they won't see it present in their dashboard. We hope you find this new feature to be useful in your treatment planning, and we'd love your feedback. Just reply to this newsletter or email us at providersupport@bristlehealth.com with any feedback, questions, suggestions, or any other way we can help. Thank you.